Japan's an amazing place. I'd love to visit. I've been probably to Kyoto a dozen times in my life. I've probably been to some of the historic Japanese landmarks more than most Japanese people have. So I just like spending the time with family and enjoying the culture in Japan. I think what's really nice about straddling some cultures is you get to see which things are kind of social constructs versus things that are universal truths. Like some of the ways we provide care in this country, it's not the only way to do it. I think the field I'm in, biomedical informatics, is really important because, healthcare, health is at the center of what allows us to live and enjoy life. And there's nothing like the complexity of healthcare, the amount of data that needs to be processed, the knowledge that needs to be processed, that I think compares in any other aspect really of most of society. And there's so much potential for improving, how long we can live and spend with our loved ones before we pass, right? So I think it's one of the most important fields, and I love being in this field. The gist of what we do is try to take data that's stored in various places, most typically the electronic health record, figure out how we can organize it, put it against clinical guidelines, et cetera, and figure out what it is that the clinical users, whether it's the patients, the providers, the caregivers, need access to make good decisions and take good care of their health. As one example, at the University of Utah, we implemented a lung cancer screening shared decision-making clinical decision support tool that addressed the fact that lung cancer is the leading cause of cancer deaths for both men and women in the US and worldwide. The current experience that providers have in our health system is they will get a prompt in the system if the patient appears eligible for lung cancer screening, and they're easily linked to a shared decision-making tool that helps them, puts in over 24 patient factors and provides patient-specific guidance on the benefits and potential downsides of screening so that they can be better informed about and get integrated into the screening program. It should be the case that patients who are getting screened will basically have about a 20% reduced chance of dying from lung cancer, which the people who are eligible for screening are at quite high risk of dying from that. We basically quadrupled the rate of screening that's available at the University of Utah. Looking forward, we are knee-deep in AI. It is, honestly, I used to be an AI skeptic, but these tools have gotten amazing. And I think the AI tools are going to really revolutionize healthcare, and I'm really glad to be a part of it. We are establishing an AI lab for the University of Utah health system that I'm deeply engaged in, and I think there's going to be tremendous potential for improving care. We are working with colleagues, for example, from the Huntsman Cancer Institute to automatically identify what trials the patients appear to be eligible for, and to really facilitate the ability of our providers to recruit and our patients to benefit from clinical trials when they're undergoing cancer. And it is astonishing. It really has the possibility of really bringing to life the promise of making sure every patient gets the right care every time. What motivates me a lot is experiences I've had, right, whether it's when there's a patient that should have been getting routine screening for cancer and gets a devastating cancer diagnosis because they weren't getting screened. Almost always the signs are available in our records, et cetera. It's just that we don't have systems in place to make sure everyone always gets the recommended care. And those are the kinds of things that motivate me to say, like, why are we doing this, right? It's because we want people to be able to live as long as they can, spend time with their family, and the data is just there. My life revolves a lot around my family, which is a pretty common thing around here. Utah's very family-centered, whether it's taking walks with my wife every night or calling my mother every day, or trying to get in touch with my son who's in college when he will make an appointment to talk with me in his busy schedule. It's the center of certainly what's important to me is my family.